I'm Richard Gunderman. I'm a pediatric radiologist at the Indiana University School of Medicine, and I'm delighted to be with you today to talk about a topic that's near and dear to my heart, namely professionalism. It's a term you hear all the time. It's one of the ACGME's competencies. Many medical schools and medical staffs have committees on ethics and professionalism. But one of the things that concerns me is that we don't spend as much time as we should talking about the meaning of professionalism. Now, some of you have heard the phrase, the world's oldest profession. That's often used to refer to prostitution. And sometimes you hear the word profession mentioned in connection with getting paid, right? If you're a professional, you get paid for what you do. If you're an amateur, you don't. And of course, a long time in the Olympics, there was a debate over whether professionals should be allowed to compete. That is not what I have in mind by professionalism. I think professionalism is something very different. I'll tell you another thing that kind of irritates me when I hear people talk about professionalism. I've been to meetings, like professional meetings, where there have been talks on professionalism, and people will talk about things like, your grooming and your attire and how you carry yourself. Now, I'm not trying to say that those things don't matter, but I think they're far from the core of what we're talking about when we refer to professionalism. Some of you may know the word professionalism is related to the word profession. What you profess is what you declare in public in front of other people. For example, getting married, taking marriage vows might be a kind of profession. You're declaring, your love for this person, your intention to stay by this person for your whole life. And I think that gives us a deep insight into the nature of medical professionalism. It invites us to ask the question, when push comes to shove, when the chips are down, what would we cling to the last possible moment? Another way to ask the same question would be this: what in your life, as a radiologist, as a physician, brings you the greatest sense of fulfillment? If you thought about your work over the past month or the past year, what would be a particular moment where you felt you were really coming to life? Partly as a radiologist, partly as a physician, but also as a human being. I would say the answer to that question gives us a deep insight into what we mean by professionalism. A professional is somebody, who may get paid for the work she does, but she's doing that work for reasons beyond the income it generates. She may be quite successful as a radiologist and moving up some kind of organizational ladder, getting promoted as an academic radiologist or making partner in a community radiology practice. But ultimately, what makes her tick, what matters most to her in her professional life, isn't making money or getting a better job title, getting grants or something like that. Ultimately, it's the difference she's able to make in the lives of other people. Now, that would be partly, obviously, the lives of patients. When was a time you as a radiologist made a big difference in the life of a patient or family? But I would say equally important is the question, when was the last time you and I made a big difference in the life of a colleague, a fellow radiologist, or perhaps a technologist, or a referring physician in another medical specialty? If we know those moments, if we can isolate how we felt when we were making that difference and determine how we made that difference, I think we can gain deep insight into the real meaning of professionalism. You have a job. Your job is what you do 8 to 5 every day to earn a living. You have a career. That's obviously medicine. You've invested 4 years in medical school and 5 years in residency, a year or two of fellowship, a lot of time and energy to qualify your career. But there's another higher stage. The job is here, career is here, profession is up here. That's what you stand up for. your core principles, your highest aspirations as a radiologist. And if you can define what those are, you have much clearer stars by which to steer. One way to figure out what that might be is this. Ask yourself, of the radiologists I know, maybe the physicians I know, who do I admire most? Who's the radiologist you admire most? What do you admire about that person? Usually it's not, does that person have the biggest car or the fanciest house or something? It's something about who that person is, their character. They're dedicated, they're trustworthy, they're compassionate. Those are the essential virtues of a true professional. And if we see those virtues in another human being, we may be able to figure out ways that we can emulate those virtues. We can't, simply copy somebody else, but we can try to take what's best in another person, one of the radiologists we admire that most, and bring that to life in our own careers and our own lives. If we do that, I think we're realizing some of the highest ideals of professionalism. So I challenge you, look around the room, search your own memory. Who do I really admire? When did I feel proudest and most fulfilled in the work I do as a radiologist? We figure out what those moments are, we figure out what made them special, and then we try to create those kind of moments more frequently in our day-to-day work lives. That, to me, is one of the secrets of professionalism. Thank you very much.